So today we're going to be talking about ulcers, particularly aphthous ulcers or ulcers that affect the mouth, and how these differentiate from ulcers that we see in relation to immune conditions. So what do I mean by an ulcer? Well, I'll show you a picture on this video of an ulcer. What we're seeing is that the top layer of the mucous membranes is gone. Underneath, we can see usually a yellowy white surface where the skin has eroded. There's usually a round pink rim of some inflammation. This may have started as a small vesicle, which is like a bubble above the area where there's colorless fluid typically, and that bursts and leaves this painful ulcer that takes 5 to 7 days typically to heal. Why do we get them? Well, perhaps it's to do with a viral infection in some cases. When you're under a lot of stress, they seem to be more common. Other factors that can affect oral health make them more likely. So things like smoking may also make it more likely. Most of the time, the cause for a mouth ulcer is not due to a persistent immune attack on the tissues in the mouth. But in a small number of cases, it might be. The first condition I'm going to talk about is Behçet's. Some people use the word Behçet's. It's a condition that particularly affects people who have an ancestry that relates back to an ancient trading route called the Silk Road. This trading route runs through Turkey, Eastern Europe, and through Iran. And what we're seeing in Behçet's is recurrent episodes of ulcers that can affect the mouth. They can also affect the genital region, and they come on and they go away without any obvious trigger. Now that could be potentially bad enough in terms of the pain that they cause, the disruption that they cause, but Behçet's can do a lot of other unusual things besides. It can cause inflammation at the fronts of the eye called anterior uveitis. It can cause a painful rash like erythema nodosum that can appear on the legs. You can have inflammation in the gut, and also it can cause inflammation of blood vessels. This can lead to Behçet's causing inflammation in the brain or even leading to blood clots in the brain. One of the hardest parts about Behçet's is there's no really good test to diagnose it. There's no Behçet's antibody. One thing you could have done is something called a pathogy test. This is where a needle is stuck just below the skin, and patients with Behçet's often get a characteristic bump that appears even though nothing's been inoculated into the skin. The presence of mouth and genital ulcers and joint pains might be enough. A genetic screen can help identify if you're in the higher risk category, so an HLA test for a specific gene type that puts you into a high risk group, that might be helping to differentiate it. Or if you've suffered one of the other organ problems like eye inflammation. The other main condition to talk about when we think about mouth ulcers is lupus, SLE, systemic lupus. You can call it different things, but we're talking about a connective tissue disease that affects the whole body, which is what systemic means. Mouth ulcers that are recurrent, particularly those that go on for long periods of time, or that are affecting a large part of the mouth, or perhaps affecting the mouth, tongue, or palate, might be more than just simple aphthous ulcers. Systemic lupus is a condition that's hard to do justice to in a short video like this because it can do pretty much whatever it wants, wherever it wants. But key things to look out for would be a photosensitive rash. That's a rash that seems to come on or get worse during the sunlight. It might cause redness around the sides of the cheeks. You may be experiencing some hair loss, especially if it's causing a bald patch to appear called alopecia. You may also have Raynaud's, where the fingers become a deathly white color in cold weather. You might have associated migraines. You may have had some major medical problems in the past, for example, a blood clot or a miscarriage. You may be suffering from dryness in the mouth or eyes, joint pains, and others besides. But these are some features where we start to think, hang on a second, multiple symptoms, multiple different parts of the body. Could these mouth ulcers be related to a condition like lupus? Okay, so what do you do if you're suffering from mouth ulcers? Well, if it's once in a while, they're lasting less than 5 days, and they're confined to the mouth, there might not be much you can do, but perhaps put some soothing gel over the area, and some people use topical steroid. But if you're thinking that this has been going on for a while, or you're having any of those other features that I've mentioned, it may be sensible to get a rheumatologist to assess those mouth ulcers and determine if they might be related to another form of connective tissue diseases. And this can be done in the most instance by taking a thorough history, examining you, and doing some specific blood tests, such as an anti-nuclear antibody, and if that's positive, maybe considering extractable nuclear antibody tests and double-stranded DNA tests. I hope this introduction into mouth ulcers and whether that could be related to your immune system is helpful. There's going to be some more videos about some of these blood tests coming out. If you have any suggestions or comments, or you'd like me to do anything in more detail, drop me something in the comments. And if you found it helpful, give me a like or a subscribe. Thank you.